Welcome everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Please be reminded that public health measures continue to be the most important protection to prevent the spread of COVID-19. Stay home if you are sick, maintain a 2-meter distance from others, wash your hands often with soap and water, or use an alcohol-based hand sanitizer. Use proper respiratory etiquette by coughing into a tissue or your sleeve, and wear a mask when attending commercial establishments. For area businesses, visit our website to access our Safe Return to Business Toolkit. I will now report our current case counts. There are 108,829 confirmed cases of COVID-19 in Canada and 37,052 cases in Ontario. Chatham-Kent has 168 cases, and Sarnia-Lambton has reported 287 cases. Michigan now has 71,197 cases, with 12,052 cases being in Detroit. Today, we are reporting 1,857 cases of COVID-19 in our community, an increase of 17 cases from yesterday. 11 are workers in the agri-farm sector, 6 are in the community. 1,248 cases have now resolved. 514 people are self-isolating. 27% of our cases are between the ages of 20 and 29 years, and 24% are between the ages of 30 and 39 years. 65% are male and 34% are female, with 1% unknown at this time. Our community has lost 69 people to COVID. 49 deaths have occurred among residents in long-term care and retirement homes. There are 2 long-term care and retirement homes in COVID outbreak. In addition, there are 5 workplaces in the agriculture sector and 1 workplace in the manufacturing sector experiencing a COVID-19 outbreak. Symptoms of COVID-19 can range from mild to severe. Some common symptoms include fever, a new or worsening cough, a barking cough, chills, sore throat, and shortness of breath. Call 911 if you have difficulty breathing and are struggling to breathe or speak, or are experiencing severe chest pain if you are feeling confused or losing consciousness. Please be reminded that Windsor-Essex has 2 COVID-19 assessment and testing centers, Erie Shores Healthcare in Leamington and Windsor Regional Hospital Alet Campus. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. To check your results, please go to www.wechu.org and click on View Your Results to access the online test result portal. If you are unable to view your results, please contact the assessment center or healthcare provider that initiated your test. The health unit will call anyone who has tested positive. Please continue to visit our website at wechu.org for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, for further updates.
Good morning. Thank you everyone for joining us again. COVID-19 pandemic is stressful for many people, and it has caused a lot of fear and anxiety among many. With a disease that is new to this world, it can be overwhelming due to many uncertainties that can cause strong emotions in both adults and children. Public health measures such as physical distancing and limited recreational opportunities can make people isolated, lonely, and can increase their stress and anxiety levels. Many of the public health measures are necessary to stop or reduce the spread of COVID-19, but it can also trigger many other reactions, such as fear and worry about your own health and the health of your loved ones, your financial situation or job, or loss of supports you normally rely on. It can also impact your changes and cause changes in your sleep and eating patterns. It can lead to difficulty sleeping or concentrating, worsening of chronic health problems, worsening of mental health conditions, increased use of tobacco or alcohol and other substances. Residents across the province of Ontario and Windsor-Essex have spent the majority of their time at home over the past few months. The stress of the pandemic has had an impact on our mental health and daily habits, including alcohol consumption. A recent study conducted by NANOS for the Canadian Centre on Substance Use and Addiction found that 25% of Canadians were drinking more while at home during pandemic. Individuals who reported drinking more cited boredom, stress, and lack of a regular schedule as the main source or main factors for their increased alcohol consumption. We know that individuals with underlying chronic conditions such as high blood pressure, heart disease, cancer, and cardiovascular disease are at greater risk of severe outcomes due to COVID-19. Even small amounts of alcohol can increase risk for chronic diseases such as cancer, and year-over-year alcohol contributes to the highest number of substance-related emergency department visits. Alcohol can also increase the risk of injury due to fall, motor vehicle crashes, drowning. It can also lead to violence, including intimate partner violence and sexual assault, alcohol poisoning, mental health disorders, depression, and suicide. It is important that stress, especially during this time, is managed in healthy ways and that individuals know when and where to seek help if they need it. That is why this week the Windsor-Essex County Health Unit launched a new communication campaign focused on alcohol. Through media, radio, and social media ads, we hope to encourage individuals to seek help and connect with services in our communities when they need it. To lower your risk related to alcohol, avoid using alcohol to relieve stress, follow the low-risk drinking guidelines, never drink and drive, avoid drinking especially if you are pregnant, taking medication, or under the age of 19. To find resources for alcohol and treatment providers, please visit our website at www.wechu.org and type alcohol in the search box, or visit www.wecoss.ca. That's www.wecoss.ca. If you are currently experiencing a crisis, please call the 24-hour crisis telephone line 519-973-4435, or for those under the age of 29, Kids Helpline phone at 1-800-668-6868. Thank you.
The conference is now muted.
We'll now take questions from the media. We'll start with AMA 100.
Dr. Ahmed, the Premier is in town today. Will you have a chance to speak with him?
I haven't received any formal invitation or connection, but I would love to speak to him and highlight some of the unique challenges that we are seeing in our region from a public health perspective. But recognizing that this trip could be a very short trip, so I'm happy that he is here to see things firsthand and to get the experience of what we are seeing with respect to COVID pandemic in our region.
Are you disappointed that he hasn't reached out? You're the medical officer of health for Windsor-Essex. There is outbreaks in the agri-farm sector. Isn't this the right time for you and him to maybe not sit down, but have a phone call or see each other while he's in the city? Or county as well, sorry?
And I've been in contact daily with the provincial officials, our chief medical officer of health, and the public health staff at the province every day on the farm issue. So I think I'm satisfied with that communication, because that's the technical piece that we need to work on, recognizing that the Premier obviously has a different role to play in this pandemic. And I respect his time and him taking the time to come down to our region. I think it's a good thing for our region that he is coming here and get to see some of the challenges firsthand. But overall, I think my contacts with the Chief Medical Officer of Health Office and the Public Health Department and the Ministry, that has been really good and is really helping us quite a long way.
Thank you.
Any questions from Windsorite?
Not at the moment.
Any questions from the Windsor Star?
Not right now, thanks.
Any questions from CTV?
Good morning. You mentioned that you're hoping to speak with Premier Ford and mention some of the unit challenges. What are some of those things that you're hoping to bring up if you do get a chance to speak with him?
I guess the unique challenges that we are seeing in our community, which is very different than many of the other communities in the province of Ontario. We are a border city with many people who are crossing the border every day, bringing in unique challenges, especially in the COVID time. When we have a significant number of people that are crossing the border to US, where the rates of COVID-19 is very different. So I think that's a clear distinction on our part. The challenges with all these transport vehicles crossing the border every day, going to US and coming back. So that's something that's unique. In addition, our migrant farm workers, our agri-farm industry, then the number of these workers in our region is the highest in the province. So we accept all those people in our region. We have got other unique challenges in terms of some of the diseases, some of the mosquitoes, vector-borne diseases that we see in our area. We also have some unique challenges with respect to the risk for flooding and the West Nile virus activity that we see in our region. So I think from a health perspective, there's a lot of issues that we live here, so we know that, but I think it's good to highlight those issues and unique challenges to the province to help them understand our unique situation and maybe help us appropriately to manage all those issues for the betterment of our community.
Thank you.
Any questions from Blackburn?
No, thanks. They are covered.
Any questions from the Canadian press?
Hi, Dr. Ahmed. Yes, I wanted to ask you if you could provide an update on the current number of agri-food workers who have COVID-19 in Windsor-Essex.
So we are working on ensuring that all the data that we have in our electronic system updated to the integrated public health information system as well. From our perspective, we have roughly around 150 cases that are active in the agri-farm sector and that we are following right now. And many of them will be discharged from the integrated public health information system that we use at the province. So the number may vary from what we have and what the province may have, but from our perspective, it would be roughly 150 active cases in our region that we are following up in the agri-farm sector.
And I'm wondering more broadly, as my colleagues here have stated, the premier's in town today. Last Friday, a lot of local health officials, or a lot of local politicians, I should say, and some health officials expressed some concern that the resources locally were being stretched and the province or the federal government needed to take a lead role in helping to address the outbreaks on farms locally. How do you feel about it? Do you feel as if you have a handle on the situation? The numbers seem to suggest you're still having a lot of positive cases down there.
At one point, we had in excess of 300 plus cases, which we're now down to 150 or so cases. So I think that's definitely an improvement from where we were. The challenges that we're seeing is just the unique nature of the industry, the nature of work that we are talking about. And also the congregate living setting that we are talking about. There's clearly at least 3 different ministries that are involved directly with this agri-farm sector outbreak. The UMAFRA, Ministry of Labor, Ministry of Health, we all have different roles and responsibility in that. And then to put further challenges into that is the role of the federal government in bringing these temporary foreign workers, and the role of public health in managing this outbreak, and then the role of acute care hospitals, the need for primary care for these people, and then the accommodation challenges with these individuals when we have to accommodate all these people. If someone is living in the community, if any of their close contact, they need isolation, it's easy. We can just ask them, it's your home, you just isolate yourself in one room, and then things are relatively okay. When we're talking about these congregate setting, Some of these individuals are living in a room with 6 or 7 or 8 other people in the same room. That makes it very challenging for them to isolate from them, so they need to be removed from that setting into an isolation hotel or some other facility where they can be safely isolated. So we need some coordination from that perspective as well. And then on top of that, the language barrier is there. We're talking about people coming from Mexico, Jamaica, Thailand, Vietnam, so many different places. So it's one of those unique challenges. The cultural barrier that we are talking about, that how we will bridge that understanding of physical distancing, ensuring that they understand the norms. So there are a lot of challenges, and I think that's where, when we are talking about the coordination piece, that's why it is critical that we have a good system in place where all of these different aspects are covered appropriately. And I think that's where the key is. And with some of the work that was done more recently, we're seeing it all coming together, but clearly it's a very complex issue that requires multiple level of cooperation locally, provincially, and federally.
Might just be permitted one more follow. Dr. Ahmed, I hear what you're saying. I also understand that there are more farm workers on the way, a couple thousand more perhaps, into the region over the next few weeks. In the absence of any further coordinated federal or provincial response, does the health unit have a plan to address the needs of these new workers and isolate those workers that you mentioned that are living 6, 7, 8 people per room in some of their accommodations?
So again, that's why some of the challenges are, obviously we are not an expert in accommodation or finding accommodation. So we are definitely getting some support from the province through Canadian Red Cross, through the Provincial Emergency Operations Center. They are coordinating all those responses to ensure that the accommodation is in place. And the workers that are coming in, we have already are requesting the federal government involvement and engagement in that part to maybe do more of a centralized type of quarantine for those individuals before they come to the region. And once they're in the region, obviously they will be here, and then they can be part of the local strategy that we're talking about. But clearly some of the accommodation pieces that can be covered. We're doing a lot of education with the employer as well to provide them with the right tool for anyone who's coming to the country to have all these preventative measures in place. So I think it from a public health side, based on our roles, we are definitely feel that there are some systems in place from an accommodation perspective. With the support from Canadian Red Cross and PIOC, some systems are in place. I think it just need to be coordinated in a very smooth manner. So all the partners playing different roles can all come together and with clear, good flow of information sharing with everyone, and respecting everyone's expertise and boundaries in terms of meeting the needs for these individuals. So I feel that it's all coming together, and maybe in the next few weeks we'll have a good system in place to support all these workers that are coming in our region.
Thanks, Dr. Ahmed.
Any further questions?
Questions from Amy?
Just one, it's more clarification. I'm not sure if it's for Dr. Ahmed or Teresa, but I know today there was no under investigation cases, but when there is an under investigation case, does the health unit come out? I forget if this was mentioned when these briefings started, but when there is a under investigation case, does the health unit come out and say what that case is? For example, if it was agri-food worker, a healthcare worker, or a community worker, is there a way to find that out?
Well, Rob, I'll try to answer that question. So when we're calling under investigation, so basically our staff are here at the health unit until 8 o'clock, and sometimes we get the lab results by 7:30, and we're trying our best to reach out to everyone who is positive, and at least one call is made to everyone who's in the list to ensure that they are self-isolating immediately, pending further discussion with our team. And in some instances, if we cannot reach to the individual for any reason, either an incorrect phone number or the person never picked up the phone, It is deferred into the second day when our team is are trying to reach out to them to meet the 24-hour timeline that we follow in public health. Once that information is collected, we use that information for our reporting purposes for our follow-up with our team. You may see that as an aggregate number, but I think it would be impossible for us to report back that how many we investigated and then what does that number look like. When you're looking at the weekly statistics, that will be the best avenue to see all those details for your understanding.
Okay, thank you.
No problem. Thank you.
Any further questions from Windsorite?
No, thanks.
Windsor Star,
No, thank you.
CTV,
No, thank you.
CBC,
No, thank you.
Blackburn,
No, thanks.
Canadian Press.
All good. Thank you.
Thank you very much, everyone. Have a good day.